Hi everyone, it's Dr. Jhawar with Revive MD Direct Primary Care. So I talked a little bit about sugars, table sugars, sucrose, and other sweeteners like honey, maple syrup, and dates in my last video. What I also wanted to discuss was, about the fact that, we know ill effects of table sugar and fructose and things like that, and what kind of diseases those can be linked with. However, artificial sweeteners and other sugar substitutes, oftentimes people think those are considered healthy. And some may be healthy in short term. However, there are lots of studies that have shown some negative effects of artificial sweeteners or sugar substitutes. For example, some of them can lead to increased risk for cancer. Some of them can lead to increased risk for heart disease. Yes, they can also raise your blood sugar and your hemoglobin A1C. So I know a lot of times people think that won't happen, but it can. So there are lots of other disease effects from even artificial sweeteners and sugar substitutes. So it's hard to kind of figure out, well, which one should you be using? What ingredients should you be looking at when you are picking out certain foods, drinks, things like that, and what you should maybe sort of limit yourself to. And we're going to kind of discuss this in more detail, but I just wanted to let people know that yes, though there can be some health benefits with artificial sweeteners and sugar substitutes in the fact that they are sweeter, so oftentimes you will probably add less to your drinks or your food and take in a lot less of those than regular table sugar. And also they have usually like no or very little calories as well. But there can be other ill effects, just like I mentioned, like on your heart, cancer risk, sugar spikes, type 2 diabetes, weight as well. So we'll talk more in detail about the different categories, but just wanted to give you a little intro on, what's the good and the bad with other sugar substitutes as well. I'll be back with more videos.